So surgery was kind of the passion all along. You know, that's really why I got into medicine to begin with. I knew early on that I wanted to work with my hands, so we cover a lot of primarily intra-abdominal stuff, so anything going on in the belly, including hernias, colon issues, small intestine issues, stomach problems, gallbladder. Most of my practice is a robotics practice, so minimally invasive surgery, small incisions, outpatient surgery. A lot of our patients who end up needing colon resection for colon cancer end up getting it robotically, and many patients, their incision is no bigger than a few inches long for to remove half the colon. So it's a highly skilled thing, and something that we've kind of honed our skill over time, and it's great for us, great for the patient more importantly, because they're having what used to be a large incision and 7, 8, 9 day hospital stay. Now they're going home on day 2 or 3 after these complex procedures. But patient care is really the most important thing to us. Whether or not a patient ends up needing surgery, that doesn't really matter. We just want to do the right thing for you. So my real work happens when I leave here. I have 3 kids, all under the age of 5, and number 4 on the way.